In this video, let's go over your superficial back muscles. So these are the muscles that act on your scapula and your upper arm. And these muscles, they're not true back muscles. True back muscles are innervated by posterior rami. And these muscles, you're gonna see that they're innervated by anterior rami or your brachial plexus. These muscles are very essential to control scapular stability and position and also act on your humerus. We're gonna break down these muscles so you understand where they're located, their function, and most importantly, how they contribute to human movement. Hi, I'm Andrew with HNL Movement, and today we are going to dive into the anatomy, functional anatomy of the superficial back muscles. With these muscles, we're going to go over origins and insertions, innervations, its main actions in isolation, but more importantly, we're going to go over how it contributes to functional application in human movement and also how to stretch these muscles. Stay tuned to the end of the video. We're going to talk about the serratus posterior. A lot of people don't even really know where the muscle is or what it does, so you're going to want to listen in on that. And with that, let's jump into the video. Let's start going over the muscles. So the muscles that we're going to go over today is the superficial group, which consists of your trapezius, latissimus dorsi, levator scapulae, and rhomboids. And in the intermediate group, what I mentioned in the intro, we are going to go over the serratus posterior, where probably a lot of you have not been familiarized with the serratus posterior, so that will be an interesting muscle to cover. So getting started with the trapezius. So the origin of your trapezius, it starts on the medial third of your superior nuchal line and your external occipital protuberance on the base of your skull. Then it goes down your nuchal ligament, so that's the ligament down your cervical spine, and then it's going to attach to the spinous process of C7 to T12 vertebrae, so all the way down here at the bottom of your thoracic spine. Then the insertion, that's going to be more distal or away from the axial skeleton. You can see that it attaches to the spine of the scapula here. Then it's going to attach to the acromion on your scapula, and then you're going to see the lateral third of the clavicle. That is where it's going to end its attachment. So again, it has a very broad attachment site. And this is functionally, when we start to talk about the deltoid, this is where the deltoid also attaches along this horseshoe-like region of the spine of the scapula, acromion, and lateral portion of your clavicle. So let's go over the innervation. So this is innervated by your spinal accessory nerve, cranial nerve 11, which supplies majority of the motor fibers. And then you have cervical nerve root 3 and 4 that contribute more to pain and proprioceptive fibers. So your trapezius, because fibers are running in different orientation patterns or different lines of pull, you can see that upper fibers, they kind of go from the skull down to your shoulder. And then you can see the lower fibers that go in an upward fashion towards that area of your spine of your scap on the medial side of your scapula. So because of that, it's going to have a lot of different functions or actions. So your upper fibers, it helps to elevate your scapula. The lower fibers depress the scapula, and the middle fibers just retract the scapula. It's going to pull the scapula towards the spinal column. With all of that, your upper and lower fibers, they work in a cohesive manner to upwardly rotate your scapula. So upward rotation, again, is if you think about the glenoid, it is going to rotate the glenoid so that it starts to point up, and that's usually going to coincide with a lot of elevation of your arm or lifting up your arm above shoulder height. The trapezius, again, it really functions to help stabilize your scapula for, of course, shoulder function, deltoid action, but really with all shoulder and upper body exercises. It's going to help with upward rotation of the scapula, especially when you're doing things that involve your arm reaching overhead or above shoulder height. In many lifts that we do, especially things that we're holding on to weight, it prevents the shoulder from falling anteriorly and inferiorly because it's going to have that retraction component and that elevation component of your shoulder blades or your scapula. So you see this primarily in shrugs, in rowing types of exercises and movements, even things like deadlifting when you need to hold the bar and you need to retract and keep your shoulder blades in that neutral position. And because of its orientation, you're going to use your traps, especially the upper trap, for a lot of neck stability. In football especially, it's primarily used to absorb that contact so that your shoulder does not depress when taking the collision or the hit. So these are all functional applications of what your trapezius does. Provides a lot of scapular stability and keeping the scapula and shoulder girdle in place, counteracting forces of gravity or anything that's depressing your shoulder. To stretch your traps, you're going to stretch it in varying angles depending on what section you're trying to lengthen out. So your upper traps, typically that's going to be with shoulder depression and moving your head to the contralateral side. Also with some flexion, that'll help to get some of those fibers stretched and lengthened out a little bit more. For the middle fibers, extreme protraction. So usually grabbing onto something, rounding your shoulders and protracting your shoulder blades forward, that is going to get the mid traps. And for the lower fibers, you are going to try to create protraction. And typically what I like to do is have my arm below shoulder height so that you get some downward rotation of the scapula along with that protraction. And that is how you're going to lengthen out your lower trapezius fibers. The next muscle that we're going to go over is your latissimus dorsi. So if we take away your trapezius muscle, you're going to see that in that inferior portion, your trapezius sits over your latissimus dorsi. So if we hide that, you are going to see that you have your latissimus dorsi. So just like what the name describes, latissimus, I believe, is broad muscle, and dorsi, dorsal aspect of your body, so the backside, posterior side of your body. So you are going to see your latissimus dorsi, which originates from spinous process of T7 to T12, and then it's going to attach or blend in with your thoracolumbar fascia, which is not really shown here. But your thoracolumbar fascia then will blend into your iliac crest, and the latissimus dorsi will attach to your iliac crest, and then the inferior 3 to 4 ribs, it will have attachment sites on there. So you can see down here, that's where it's going to attach to as well. Insertion of your latissimus dorsi is going to be, the textbook that I'm referring to says floor of intertubercular groove of the humerus, or some textbooks and literature says that it's on the medial lip of the intertubercular groove. But the intertubercular groove is where your biceps long head tendon sits, and that's where the lats are going to come up onto the humerus and attach on that medial aspect or floor of the intertubercular groove. Then the innervation of latissimus dorsi is your thoracodorsal nerve coming off of the posterior cord of the brachial plexus. So this is innervated by nerve roots C6 through C8. And the action of your latissimus dorsi is that it extends AD ducts and internally rotates the humerus. So let's get into the functional application. So this acts on the GH joint and indirectly on the shoulder girdle. Your lat does have some fascial connection to the inferior border of your scapula. So there is going to be some communication and some influence on scapular stability. But primarily your lats are going to act on the humerus or your arm. Even though it has this broad attachment along thoracolumbar fascia and your spinous process, your lats really do not have too much contribution to creating movement or motion in your lower back or your lumbar spine. So it's going to primarily be stable in that region and act on your upper extremity. We use the lats in a lot of shoulder adduction movements, so lat pull downs, pull-ups. If you think about it as a shoulder extensor when you're in front of your body, then we have front lat pull down variations. Obviously shoulder adduction movements like cable types of shoulder adduction movements. And also when you think about any lat exercises, there is an internal rotation component at the shoulder joint. Functionally, like in sports, things like swimming, paddling, even boxing, there's a lot of lat activation when you're completing a punch to internally rotate and also pulling your arm back. And when we're doing any types of exercise that we need to activate our back to stabilize our shoulder joint, like deadlifting, even powerlifting, Olympic cleans, all of those require a lot of latissimus dorsi activation. To stretch your latissimus dorsi, you either need to do extreme shoulder flexion. External rotation also helps with the humerus. One of the favorite stretches that I like to incorporate is when you're in shoulder flexion with your elbows bent and you're externally rotating your shoulders. You can stretch your latissimus dorsi unilaterally by grabbing onto something and going into protraction and shoulder flexion as if you're holding on to the side of the squat rack or holding onto a band. So those are some of the main ways that you're going to stretch your latissimus dorsi. The next muscle we're going to go over is your levator scapulae. So the origin of your levator scapulae is on the posterior tubercles, basically of your transverse processes of C1 to C4, as you can see here. And then it's going to insert on the medial border above the spine of the scapula, and it's going to be innervated by your dorsoscapular nerve coming off of, primarily textbooks will say C5, but some will say C4 and C5. And it also has some innervation from cervical nerves, C3 and C4. The action of the levator scapulae, you can see here, is that it's going to elevate and downwardly rotate your scapula. So again, downward rotation is when the glenoid starts to point down and you're rotating your scapula so that the inferior border is moving more medially and the glenoid is pointing down again. This muscle, you can see again, it has this slight coming from your spine and going more in a posterior fashion. So it can hold a lot of tension, especially with forward head posture, and can be a contributor of some cervicogenic headaches if you have a lot of excessive tension here that's compressing your cervical spine and some of the nerves too. So the functional application of your levator scapulae is that it contributes to this downward rotation of the scapula, but more importantly, it's going to act on your cervical spine. So bilaterally, it's going to create cervical extension, and unilaterally, it's going to create ipsilateral lateral flexion. So lateral bending to the same side of which side is contracting. To stretch your levator scapulae, you're going to go into contralateral lateral flexion and some cervical flexion looking downwards, and that is going to stretch out your levator scap on the opposite side. Also, what I see clinically is that if you have poor scapular stability, the levator scap tends to hold a lot more tension, tries to provide a little bit more scapular stability, but this is not the most ideal way to make up for lack of scapular stability. So that could be an issue too. If you have poor scapular stability, you might be overusing your levator scapulae, and that could be problematic for head posture, neck tightness, and things like that. And the next muscle right underneath your traps is your rhomboid. So your rhomboids, you're going to have rhomboid major and rhomboid minor. The origin for the minor is from C7 to T1 spinous process, has some attachment to your nuchal ligament too in your cervical region. And your rhomboid major is going to be right below that, so levels T2 through T5 spinous process. And all of these muscle fibers are going to go in an inferior direction slightly and attach to the medial border of your scapula. So the minor will be above the scapular spine, the major will be from the medial border below your scapular spine to the inferior angle of your scapula. The rhomboids are innervated by dorsoscapular nerve as well, so coming from C5. And because of the orientation, its action is to primarily retract the scapula towards the spinal column, downward rotation again, because it's going to point the glenoid downward, and it's going to play a significant role to fix the scapula to the thoracic wall. As we start to go over other muscles in other videos, you're going to see that the rhomboid major and minor, it works together with the serratus anterior to pin down the scapula to the thoracic wall or your rib cage. So the rhomboid major and minor, the functional application is heavily involved in rowing movements. Typically when your elbows are below shoulder height, because then you're going to have this downward rotation of the scapula and you're going to have this scapular retraction. A lot of upper extremity pulling and retraction exercises, anything from cable rows to barbell or dumbbell rows, but also anything that you're holding weight in your hand when you're in a hip hinge type of fashion, like deadlifting, beginning parts of powerlifting, cleans. The rhomboids are going to help to create a lot of scapular stability along with your trapezius muscle. To stretch your rhomboids, you're typically going into extreme protraction and slight upward elevation. So you can grab on something that's higher than shoulder height, get your humerus above shoulder height, and then protract your shoulders. Usually grabbing onto something like the side of the cage if you're stretching both sides bilaterally, or grab onto the cage or a band to stretch one side at a time and rotate into your upper arm. So now for the superficial back muscles, now we're below those four muscles, we're in the intermediate layer, and this is where serratus posterior sits. So a lot of people, you may be familiar with serratus anterior, but because there is an anterior, there usually is an equivalent posterior muscle, so this is serratus posterior. And basically you have a superior and inferior portion of the muscle, as you can see here. The serratus posterior superior, its origin is on the nuchal ligament in the cervical spine region and C7 to T3 spinous process. The inferior originates at T11 to L2 spinous processes. Then it's going to insert to the ribs. So the superior portion, it inserts to ribs 2 through 5, and the inferior portion, it inserts through ribs 9 through 12, as you can see here on the model. The serratus posterior, both superior and inferior portions are innervated by the ventral or anterior rami of corresponding levels. So the superior T1 through T4 and the inferior T9 through T12. And this is the fun fact about the serratus posterior, is that it is a muscle that typically is not covered widely in curriculums. I did not really know about the serratus posterior until I got to my graduate program. So in the textbooks, it will say that the superior portion will elevate the ribs, the inferior portion will pull down the ribs or depress the ribs. But in reality, it's not conclusive of what this muscle actually does or contributes to as far as movement. It's not really thought to have that much of a respiratory role in some of the literature because it has not been shown to be hypertrophied in conditions where breathing or respiration becomes a little bit harder, as in COPD, and because of that, it's not thought to be part or have a role in respiration. A lot of times these muscles are very, very small when you look at it in a cadaver. Oftentimes it's so thin, it's been reported to be even like 1 to 2 millimeters in thickness. So because of this, it's not going to be a force generating muscle as we originally thought. And because muscles do have some type of purpose, it is thought to be more proprioceptive in nature and maybe give a lot of feedback or sensory information based off of where the ribs are in space. So that is the fun fact of serratus posterior. It's not really a muscle that produces a lot of force. It's still relatively unknown as to what it actually does, but it is a muscle that is on the backside and part of the intermediate layer of your extrinsic back muscles. So that's the overview of the extrinsic back muscles. So now hopefully you have a better understanding as to where they are, what they do, and more importantly, functionally, how they contribute to human movement. Hopefully you can use this information and apply it to your training, your clinical practice or coaching practice. And if you like this video, hit the like button below, subscribe to my channel. If you have any questions or feedback, drop it in the comments below. And stay tuned for more anatomy videos in the future. Aloha.